I was a bit hesitant, wasn't I?
Yeah.
I was expecting to, Stacey had been, and then like it's a free event, it's like a lead magnet, and then come back, wanted me to go, and I'm thinking, oh God, we're going to be walking across hot coals. And within an hour, I'm like, yeah, let's sign up. It was unbelievable. Welcome to How to Build a Profitable Nutrition Business. If you love nutrition and you love helping people and you want to be in the game long enough to keep doing that, then this is the podcast for you. Let's get into it. All right, so I'm with my wife and business partner, Stacey Hughes, and today we're talking about all the key moments in our business that allowed us to go from, negative however many dollars to 1.4 million in about 4 years. I think that growth happened. So Stace, what's top of your list? We briefly introduced, so just to recap, the first one was coaches, productizing our service, and then understanding the importance of value. Should we dive a little bit deeper into the coaches side of things?
Yeah, so coaches, we started out with Business Blueprint. It's a membership where it's probably the best business membership that you can find in all of Australia, led by Dale Beaumont.
I was a bit hesitant, wasn't I?
Yeah.
I was expecting to, Stacey had been, and then like it's a free event, it's like a lead magnet, and then come back, wanted me to go, and I'm thinking, oh God, we're going to be walking across hot coals. And within an hour, I'm like, yeah, let's sign up. It was unbelievable, and still to this day.
Yeah, we're still a member of that community and have been since like 2017. So it's been well worth it, but not just professionally, also personally as well. It's great personal development for both of our mindsets to really work on that growth mindset.
And it gets you out of the business. You go away and you think of things that you'd never think of when you're buried in the business. It's just that opportunity to get away. And they have international conferences. So we've been to Fiji with the kids and Singapore.
Yeah.
It's just, I can't speak highly enough of it.
Yeah, it's great. And we're going soon in a couple of weeks again.
And
then the other coach that was pivotal in our business was Pete Clark. You watched a webinar by him. And
so this was a specific dietitian coach.
Yes.
Yeah.
So he was really good in helping you come up with different ideas about your business.
Yeah. And he wasn't looking to coach. I reached out to him.
Yeah.
I watched him on a webinar and just like, I've got to speak to this guy. Help. Yeah, he was great.
And the other one was when we were looking to productize our services because you'd written a book and to move online, I joined up with Tina Tower, and that's when we moved the book to an online course.
Yes, yeah, and that's another program that you're still a member of.
Yeah,
Tina's amazing, the content that she puts together.
Definitely, yeah.
Yeah, so it's tapping into that knowledge, which has kind of been really fundamental for our business. So the coaches, I cannot stress enough, and this is coming from someone who never would have considered hiring a coach.
Yeah, but also you got to see that it's a return on your investment as well. So you actually have to take action from what you learn. That's the biggest part, isn't it?
Well, and for me as a dietitian, there's very little business or marketing. Like half of our profession goes into private practice, so there's very little training in that.
Yes.
Yeah. So it's kind of, I think it's a key skill now, or a key thing to consider when you're starting out, is get yourself a business coach.
Yes. And then having various locations, we explored different areas around central Queensland, which are really pivotal in.
Yeah, so that was born out of the need to have a full clinic every day. So we had to have a full clinic because I had mouths to feed. I needed to see as many people as I could. I never factored in my time of travelling, so I'd be travelling hours a day to get to a clinic to fill it. So early on, it was just born out of desperation, I guess, but later on it actually enabled us to put a footprint into these areas. So like if you're starting a practice and you're in a big capital city, the travel's not going to be as bad. Yeah. So it's a great idea to diversify and have some locations around the city. And that way, if you're big enough, which is what happened with us, we sort of grew. And then by the time I was ready, I could put a staff member in that place, and it didn't take long to build a full-time caseload.
Yeah, so that worked out really well. Grants, accessing government grants really helped us as well, because that allowed us to hire dietitians. Because we're regional locations, we were able to use those grants to hire dietitians and hire our admin staff as well.
We couldn't have grown without it.
We couldn't have grown without it, no.
They were $20,000 each.
Yeah.
And that, we were employing new grads because we were mostly seeing, bulk billing or, like government funded clients. And without these grants, when you're employing a new grad who essentially will lose money for you for the first 6 months because they're just finding their feet, their retention rates aren't great with clients, these grants really buffered that, enabled us to set up an office in Mackay, which is the only place we went that was a cold audience. Yeah, they were pivotal. Again, this is the business brains. I'd never heard of grants.
And then the next one was you wrote a book. That was another one you resisted as well. So
I did not want to write a book.
You did not want to write a book at all.
No.
But I went to the free half-day seminar and I was like, this is something you have to do. To reach more people. I just knew, I could see Chris just seeing so many people every day, and it's just that one-on-one, and you just can't reach enough people.
I was burning out, Yeah, Stacey's a bit of a marketer's delight, but a lot of that has paid off for us. So
you wrote the tweaking diet, which we went into a second print run with that eventually. So it's something we could sell through the clinics, we could give away to people. It just gave you credentials, I guess. It just something else, doesn't it, that you're an author.
I was shitting myself because massive imposter syndrome. Like, who am I to write a book? And Stacey had signed us up for this program, which wasn't cheap.
No.
And we couldn't get out of it. And I was like, what did you do that for? And so there was a bit of tension there for a little while. But anyway, the process clinically for me has been fantastic because it's like, even though I was extremely busy writing it, the process that Nat Denman puts together makes it very easy. But the review part of it, you still got to go and, you're mentioning anything, you got to go and again check all your research and make sure it's all up to date and validated.
You got some great feedback from peers, so.
Yeah, and clients.
So it was a great success.
It was. Yes.
And then from that led us to then productizing our service, because then we had a framework then to really work from to create an online course. So we did that and then created a health challenge. Yeah, and just really, we just knew that we had to, offer people more than just a consult.
The health challenge was kind of born out of, how do I get people to access the online course that we'd built? And the online course was built out of the book. And so the health challenge, which is a little bit controversial probably in dietetic field, but it was really about trying to educate clients because, we get such a short period of time with them. How can you get them to learn at their own pace?
Well, just like an incentive to do the work, wasn't it?
Yeah. And we put up big prize money, so there wasn't a lot of profit in the challenge for us, but what it did is it grew our private list. We doubled our social media following from 3,000 to 6,000 within an 18-month period.
Really was great brand awareness. A lot of people knew about us from the health challenges where they hadn't known about us before.
Yeah. And we'd done it evidence-based. It was glad we'd done the health challenges, but it was a lot of work too.
It was a lot of work, yeah.
So it was
and it wasn't a scalable model at that point. But it's a lot of things we could learn from it, that we can now put into place for other things. So
absolutely.
Worthwhile doing. And then with our software, we always used Halexy
as the booking
system, which was good. We had Dialpad, which was our phone system, so that we had a phone system where an admin could answer a call from any location and then book it in. So
because we had the 5 locations.
So that really helped, get those calls answered. And so that helped having that online telephone system. And then we
built our own
some
clinical
other software solutions.
Yeah, so we used Halexy as our calendar, but I didn't quite like the speed of it for the clinical purpose. And so we kind of built this makeshift thing, which in the end was phenomenal, wasn't it?
Yeah.
We're not selling this. This is not I'm not promoting it, but essentially we'd get a referral from a GP via fax or via email, a PDF. It would scan it, pull out all the doctor's name, client's name, details, send the client a text, referral acceptance to the doctor, and then a calendar link for the client to then book an appointment. So it was saving us so much in admin time.
Yeah.
And then clinically, I just enter all the client's data as I'm seeing them, height, weight. Actually, we had a pre-appointment form so they could fill that out. They would actually enter all that data.
Yeah.
And then, it would, as I sort of type things or check boxes, it would build out a letter that I could send to the doctor. And we could literally, hit the send button and it would have a PES statement, all their clinical information, and would be sent before they've even booked their next appointment.
Yeah.
It was a bit of a makeshift thing that we built, but it was
Massive
such a time saver.
Yeah, that really affected our revenue, didn't it?
Yeah. Because like our business was built on numbers, like seeing volume, and so we needed to be as efficient as possible.
Yeah.
And so that software was pivotal for that.
Yeah. And then you taught yourself Power BI so you could read the numbers on those stats.
Yes, yeah, that was, and that sort of come from Pete, our coach. He was really big on numbers and analysis, and so I taught myself Power BI, which was like Excel on steroids, if you like, and that was really great because then I could see, okay, which doctors are referring the most number of visits or the higher ticket price, like as in DVA, Department of Veteran Affairs, which we get more money for, which doctors are sending them, which ones are referring private versus bulk bill, the NDIS, and so just pulling all that apart, which you needed to do easily, didn't we? And so you couldn't do that by just looking at all the numbers on an Excel sheet. And so Power BI was great for that.
Yeah, and then we had the online calculator on our website, and we used that as a lead magnet.
Yes, well, you were really big on lead magnets, and this come from Business Blueprint, didn't it?
Yeah.
And so we built, we had a number of them, like
free things to give away to people.
Meal planners, meal plans.
7-day meal challenge.
Yeah.
But
the online calculator was powerful.
That's good, because it was on our website.
People would go there, and it had really good SEO in the end, didn't it? Like, people would look up how many calories, and this, little website from a dietitian practice in central Queensland would be, highly ranked, and we're getting leads from all over the place, which is great when you've got an online course.
Yeah.
So that was quite useful. The meal plans were like, when looking at our numbers, and this is before we had Mealzee. So I built a little bit of meal planning software into the back of our clinical database, nothing compared to what, Mealzee can do, but we had like something basically where we'd do a diet history, and then it'd copy and you could do an alternative. So you could just modify and do a few tweaks. That was good, and I noticed the retention improved with that. And that's when we made the decision, okay, we need bigger meal plans. People want meal plans. We couldn't customize them because it was just too much work and wasn't viable. There was no software there to do it quickly. But what we did was just build out like 108 or something different meal plans. So at least then there was some variety.
Wow,
we'd have
that's
a new
so
one.
many, didn't we?
Yeah, there was a new one each month then.
Yeah.
So, and I'd have clients coming back month after month just for the new meal plan.
Wow, and we have to pay the dietitians to create those meal plans, whereas now you can do it in Mealzee, so easy.
Yeah, so that was good. The InBody, that was quite a big purchase. I think we were paying $25,000 per machine, and we had 6 machines in the end. We had one in a gym as well, but clients love that, didn't they?
Yeah, they love the InBody. They would come back for that.
Again, it's something they couldn't get at home.
Yeah.
And the results from one scan to the next, variables that could affect it, but over time it was a great tool when you could see that trend.
Yeah, the tracking.
Yeah, so it was great, and there was an app, and clients really, and they were pivotal in our health challenges as well.
Yeah.
We also done the metabolic rate testing, indirect calorimeters.
Yeah.
And we, as part of our staff retention, we would take a staff member over to the Fancy conference over into the US if they had remained with us for 2 years. And the very first one we went over, one of the sessions was about cutting edge technology in the dietetic space. And it was so rewarding for me because here we were, again, a small regional dietetic practice that was doing all of the cutting edge, evidence-based, but cutting-edge technology that can help your clients. And so that was all about, InBodies or bioimpedance measurers and the indirect calorimeters. And they were great for me clinically to be able to get an idea of, what we are dealing with. Yeah, so that was another big one.
Okay, the next thing was you spent a lot of time with creating partnerships or relationships with doctors. You do doctor lunches. You'd go to the practices, and other dietitians would as well. You'd put on a lunch, talk to the nurses, and you tried, I think in a team meeting, we talk about what ones you had booked up. So there was a number we had to meet each month, didn't we, in terms of those doctor meetings.
And we'd take the InBody sometimes, or the indirect calorimeter.
Yeah.
So just to give our referring partners some sort of insight into what their clients would receive when they come to see us.
But that was really great. And gyms as well, you had a lot of partnerships with gyms, so you do a lot of the InBody You take your in-body to a gym, and they would, when they do their challenges, you'd measure all the people, and then the gyms would pay for that. So it was another revenue source.
We probably could have done that a little bit more. Like that was quite a
profitable
side
arm of our business. Yeah, definitely.
Something that we probably didn't do enough was partnerships with other allied health.
Yes.
But again, that's
about
probably
that
for the
analytics.
learnings.
Yeah. And then you diversified your services as well with NDIS.
Yes.
And DVA.
Yeah.
That's something we explored a lot more as well.
Yeah, and it was because initially it was just bulk
billing.
bills, care plans, see as many as I can. Really hard work, low return. Whereas the DVA, there's a much better return. There's a price for doing a meal plan. So all the things that you would love to do for a client, you could actually get remunerated for. And then the NDIS come about, and so it was then offering a rate that the remuneration was way better as well. So you could actually provide that service that you wanted to provide. The $50 Medicare wouldn't allow. So that was great. And then some corporate partnerships. We also went out to some of the power station.
Yeah.
And again, that is something that just that diversity, and we done menu reviews, and it really just shored up our business.
Yeah, and you tracked all that too, like in a pie chart, didn't you? And then we could see over the years how we moved away from bulk billing and into other revenue sources. So that really helped.
Well, our private consults become our dominant revenue stream, which
as
is
opposed
quite
to
powerful.
bulk billing.
Yeah.
So just tracking that and keeping an eye on it, and we were always coming up with ideas, weren't we? Always to diversify.
Yeah. Because I think we were scarred by the bulk billers. But I'm glad we did do the bulk billing. Okay, if we're starting again, would I do it again? Our advice from Pete was, they're your lost leader. You're getting all these people, and we did. Like as soon as we started bulk billing, because initially I would bulk bill healthcare card holders and children and pensioners. But anyone else I wouldn't. And then when I just thought this was too hard because I was processing the payments myself, and so when we got rid of it and just went 100% bulk billing for everyone, the referrals flooded in, didn't they?
Yeah, they did.
So it was a great referral source that then introduced people to our practice that would then come back year after year. Yeah.
So that's the key learnings that we experienced that really grew our business. All of those things working together really grew our business to that $1.4 million in revenue, grew the locations, grew the staff. Every location had an admin and at least 1, 2, 3 dietitians in each location.
Yes, which again, so that was when we become profitable too, because when you've got one dietitian in a location, and this is a debate that happens about, should you just work out of a doctor's practice? Well, the problem with that was that other doctors are less likely to refer if you're taking their patients to another doctor's practice. And so we'd made that decision. We did work at a doctor's practice in places where we went for one day, but when we were establishing a full-time caseload in an area, we always got our own office, which initially, when there's only one dietitian, it's not that profitable. It only becomes profitable when you put 2 and 3 dietitians, and that's where we started to see some profit in the business, which was quite useful. All right, so the biggest thing, Stace, getting a coach. Get a coach. Cannot stress that enough. Look into what grants are available.
Yes.
Absolutely transformed our business. Know your numbers, both from a financial perspective and from your client caseload, what type of clients, where are the referrals coming from. Productize your service. Understand the importance of value, making sure your clients feel value when they're walking away. If you've got a team, really nurture that culture, employ well, and have like employee bonuses, making sure with staff retention, because that was what we did with our Fancy conference, didn't we? Like we'd try and keep them as long as we could, because it was quite costly to employ a new dietitian. Diversify your caseload, build partnerships with your referrers.
Yes.
And look at some really good software solutions to streamline your business, or to make your business more profitable. I'm probably guilty of looking at the cost of something and not the return. So you got to look at, okay, what if I've got to pay a lot for this? Am I going to get a good return?
Yeah.
All right.
So hopefully you've got something out of that, and they're things that you could implement yourself.
Done. Thank you.
Do you find this podcast valuable? There may be other nutrition professionals out there will also. If you like, share and subscribe, it's going to help other nutrition professionals make an impact on the world. just like you. Thanks.